Hello, everyone. My name is Laz Boris, and I'm the president of the Thyroid Foundation of Canada. I'd like to welcome you all to our April 27th webinar. Today, we have a panel of 3 patients who will each describe their journey with thyroid eye disease. On our panel, we have Sylvia Sajic, Julie Sebald, and Andrea Perriman. Our guest speaker is Dr. Kelsey Roelofs, an ophthalmologist and oculofacial plastic surgeon. She completed her medical education and residency training at the University of Alberta in Edmonton. Following this, she embarked on a 1-year ocular oncology fellowship at Moorfields Eye Hospital in London, UK. She recently completed an American Society of Ophthalmic Plastic and Reconstructive Surgery fellowship at the University of California. She has published over 40 peer-reviewed papers, 19 textbook chapters, and was the 2021 recipient of the Bartley R. Frew Research Award. After each patient's story, Dr. Roelofs will address highlights of their condition. Once all the panelists have completed their stories, the audience will be able to direct questions to either Dr. Roelofs or our panelists. Catherine Keene, our administrator, will be acting as producer for this webinar. This means that she will be managing the technical aspects of Zoom. Anista Primachandran, our Director of Research, who will be looking after the chat and the QA functions. This event will be recorded and made available on our website later this week. A little bit of housekeeping before we begin. Today we're using the webinar functionality of Zoom. This means that you can see and hear the presenter and support team, but your audio and camera are not active and we are not using the raised hand feature. You will be able to communicate with other attendees using the chat feature at the bottom of the screen, so please feel free to join in. If you do not wish to see the chat previews displayed at the bottom of your screen during the presentation, please click on the chat button arrow and deselect the Show Chat Previews option. Please use the Q&A feature located at the bottom of your screen for your questions. If you have any technical issues during the webinar, please reach out to Catherine via the chat feature. At this point, we are ready to begin with the stories from our panelists. We'll begin with Ms. Sylvia Sajic.
Hello, everyone. Hi, my name is Sylvia. I am a project manager at an architecture firm in Toronto. And I am here to tell you how I've struggled with thyroid eye disease and Graves' disease for the past few years. I was first diagnosed in February 2020, and the way I got diagnosed was my mom simply looked at my face one day and she's like, Sylvia, go and test your thyroid because something doesn't look right. And yes, I in fact had Graves' disease and thyroid eye disease. And unfortunately, I didn't have severe enough symptoms to understand that something was happening. So my eyes were the first thing that showed up. So I got diagnosed pretty quickly when it comes to Graves'. My family doctor told me that most likely that's the problem, and they referred me to an endocrinologist. I didn't see one for months, unfortunately, and the family doctor did not explain that much in terms of how I'm supposed to touch base and retest every so often. So unfortunately, I became hypothyroid, and within 1 month, I started getting those symptoms and gained like 20 pounds, which was another mortifying factor to this. So by the end of that month, I finally got myself an endocrinologist, and things started looking up. They got better. I still wasn't gaining enough information. I obviously like data and like understanding. And my endocrinologist unfortunately didn't have that much time to spend with me, sometimes only 3 minutes for my test results. So I eventually started researching on my own and started seeking help from online groups and data that way. And once I saw 2 different oculoplastic surgeons, I realized that thyroid eye disease was not really treatable in Canada in any way other than waiting for the active phase to stop and then receiving surgery, which when I read the descriptions and heard from the oculoplastic surgeon sounded absolutely terrifying. So in the end, I chose to wait it out a little bit to see because I know that eyes can come down on their own. And in fact, they did. Once I went into remission and everything got better, they went down by about 1 millimeter. Unfortunately, proptosis stayed. So I started seeking alternate solutions to this problem. I contacted a ton of different trials. I tried to get myself into trials in Canada. I even almost got into a trial with one of my the surgeons I saw, which was Dr. Nancy Tucker here, and it was I think stratifisalmab, and I unfortunately last minute was denied because my eyes were not severe enough, even though they were at CAS 3. So eventually, I did find a trial that would take me in, and that was in the US, and that was by Viridian, which is a VRDN 001 trial. And I started back in October 2024, and it was infusions. This drug has been engineered to have less symptoms than Tepezza, especially with the severity of hearing loss. So this is something they've been testing for during each infusion. There were a total of 5 infusions. I have completed them all. I was on a very low, I guess, dosage of the VRDN. So the eyes dropped almost another millimeter, but not fully back to probably what I should have been within my normal range. But they still made a really significant difference for me that I am very appreciative I had that opportunity. So essentially, TED no longer dominates my life as it did before. And I'm very grateful that I was able to seek out the help I needed. I do find that the healthcare system here is a bit fractured in terms of how fast we get help, which I'm sure it's a complaint for many different people and diseases. But eventually I did get the help I needed, and I'm just now grateful that yeah, this got me somewhere. Thanks for listening. I'm not sure exactly what else I should talk about, but that's probably it for now. I can definitely make many suggestions for endocrinologists if anyone's interested, but yes, please, Laz, take over.
Thank you very much, Sylvia. Dr. Kelsey?
Yeah, thanks so much for sharing your story, Sylvia. There was a couple of things that really struck me as being a common experience, I guess, that a lot of my patients come with. Probably the first is how you presented, actually, that someone who was close to you noticed that your eyes looked different. Of course, some people present with more serious or significant thyroid, like hyperthyroidism type symptoms, but it's really not uncommon for one of the first thing people to notice is that their eyes look different. And I think that kind of carries through a lot of your journey. Like when you say that TED dominated your life, it's because like I think thyroid eye disease, it has such a profound impact on people's psychosocial well-being. Even when it's, we categorize it as mild, it doesn't mean that it's not impactful, right? Because it totally changes the way that you look, the way you identify. When you interact with people, you know that people are looking at you differently. So I think that's one really important theme to kind of keep in mind when we talk about thyroid eye disease, is that sometimes there is this disconnect between what we medically categorize as moderate or severe disease and what patients experience. And there's good research to support that in terms of anxiety and depression surrounding thyroid eye disease. Some of the other things that you talked about that I thought were interesting is, I guess, sort of your perception about the waiting through the active phase and then the options that are available for management in the inactive phase. I did my fellowship at UCLA, and then I stayed and practiced in Los Angeles at UCLA for a couple years. But recently I moved back to Canada last year, I guess. So there are different ways that different diseases are managed in these different healthcare systems. I think probably the one thing I do agree with you is that there's way fewer doctors in Canada, and so the wait time to get in to see somebody can be longer. And I think that is one of the most important things that we can change as we increase awareness about thyroid eye disease, right? Because it all comes down to meeting the right person at the right time and having a good understanding of what the trajectory is of your disease course and feeling like you're not in it alone. I mean, you're very smart, intelligent, driven. You did all of your own online research. Not everybody who has thyroid eye disease is going to be that independent and motivated. So I think one of the best things that can come out of all of this talk about some of the new, exciting, albeit not perfect, medications for TED is that there will be an increased awareness. And I think that'll help a lot of people who struggle with what you struggled with, which sounds like finding the right physician, the right, advocate and person to help kind of guide you through some of that experience. So thanks so much for sharing your story.
Thank you, Dr. Roelofs. And now I guess we'll go over to Julie. Julie, would you mind giving us your story?
Okay. Hi, everybody. My name's Julie, and I work in retail. I work at Home Depot. I first started, my thyroid journey first started back in January of 2022. I developed quite rapidly symptoms of hyperthyroidism, which I didn't at the time know that that's what it was. Um, I I started to suddenly have heart palpitations and rapid heart rate, um, trembling, all within a period of about 4 weeks. Extreme weakness. It was a very fast onset after an illness of about a week and a half. I had been sick. I had, and I'm not trying to suggest that this might be the reason, but I had my third COVID vaccine December 31st and fell very ill immediately afterwards. So, and then progressed into the heart palpitations. And I quickly reached out to my doctor, who got me checked. Actually, she sent me to emergency because my symptoms were so bad. I couldn't walk up the stairs. It was all very sudden and very scary. I thought I was dying. And so they diagnosed me with hyperthyroidism. My numbers were very bad. I wish I could remember what they are. I should have written them down. I'm sorry. They were way off the charts. And 9 months prior, I'm one of those people that goes to the doctor fairly often. So 9 months prior, my thyroid has always been normal. My thyroid, I go for regular doctor checkups. I've never had any issues. So it was surprising to find myself so off the charts. She actually called me on a Saturday and had spoken to a cardiologist. And so anyway, I immediately got referred to an endocrinologist who did some tests for Graves' disease. She did a test for Graves' disease and it came back positive. The medication offered at the time was Tapazole, and so I began taking Tapazole to try and, I guess, settle the thyroid down and get the numbers back into a normal range. So we tried that for about 18 months, the Tapazole, adjusting the dose, and it really wasn't helping much to move the numbers where we wanted to see them. So over the course of the 18 months, probably maybe 12 months, I started experiencing trouble with my eyes, more so just an irritation, a scratchiness, watering, and just a bit of discomfort. More like I would say to my endocrinologist, it felt like I had sand in my eyes or that they were dry. And so as the Tapazole was not working and I was feeling these symptoms of the eyes, she referred me to an otolaryngologist. I think that's the specialist that does thyroid removal, or otolaryngologist. I'm sorry, I don't know the name of the specialist, but we started talking about removing my thyroid because since I was showing signs of eye disease, she felt that the radioactive treatment would not be an option because that might make it worse. It might exacerbate the eye disease. So I got referred to the specialist, and we agreed to remove my thyroid. So October 30th of 2023, I had a complete thyroidectomy, and it went very well. It was just a day, and I was feeling so much better. My thyroid numbers started to come into a normal range very soon after that. They did find, which was a surprise to me after the removal, after the biopsy came back, because they had biopsied the thyroid, and it was found that I had thyroid thyroid cancer, which was not on my radar at all. I did not know that. I mean, I didn't know that that was a surprise to me, to find. And it was, fortunately, out of all of the thyroid cancers, it was the more common papillary carcinoma that I guess has a better outcome than some of the other cancers. So so that was a shock to me. So my endocrinologist referred me to a different endocrinologist in the area. I'm in the Greater Toronto area, who also has some experience with thyroid cancer. She wasn't comfortable handling my situation at that point once cancer was identified. So I started seeing a different endocrinologist who I currently still see. I'm currently still seeing all of the specialists. The endocrinologist who referred me to an eye an eye surgeon, ophthalmologist, as well. And the eye surgeon, they did a CT scan to see. Sorry, I'm going to rewind a bit. So after they removed the thyroid, the levels became normal, and I was feeling great, except for about 3 weeks after the surgery, my eyes started actually were more, I'm not sure if the correct term, but bulging more out. And that got worse. So my thyroid eye disease actually got worse after they removed my thyroid, which I had thought would be the opposite, that it would get better. So I started seeing the eye specialist, and he indicated that it could take up to 2 years for after the thyroidectomy to resolve. And if you see I'm kind of squinty, it's because I do have sensitivity to light, and if I really get excited and talking about something, my eyes do get very large, much larger, and my friends and family, of course, noticed that, and it makes you self-conscious and you're very aware of it. So I have been still continuing to see the eye surgeon, the eye specialist every 3 months, and my endocrinologist is every 4 months now. So one of the things that I did with the eye surgeon is that he recommended that I try gluten-free diet, and I started January 17th. I have noticed a definite improvement in the double vision since I've been doing that, which is encouraging. I don't know whether it's just the trajectory of the condition that's getting better, or if it is the gluten, but I'm willing to continue trying that just to see if it helps. I was referred to a rheumatologist, and he gave me a couple of options of some prednisone and drugs like that, which I was a bit nervous to try. So I decided to stick to the gluten. But like Sylvia said, there really isn't any treatment for thyroid eye disease. So I've kind of been seeing all these specialists. I've been going through all these things, but I'm still living with it, and it's still affecting my life. And I would like to just be back to normal, but I don't know if that will ever be the case for me. So that's why I agreed to come on and talk about my situation, hopefully find connections or people that are also going through similar situations, because I really think it really needs to have some focus for those of us that are suffering. Sorry, that was a bit long.
Julie, thank you very much for your story.
Uh,
No problem. Thank you for having me.
That was a wonderful story, Julie. You also bring up some really, really great points. You know, one of the things that you bring up actually is kind of controversial amongst like different medical and surgical specialties, and that's the connection between thyroid eye disease and systemic thyroid function. The majority of literature in the scientific journals would say that there's not that much of a direct connection. Like even if your thyroid is poorly controlled, usually the eye disease is a relatively separate process. But even though I think that's true for the majority of patients, it's definitely not true for everyone. There are some people with really severe thyroid eye disease that having a thyroidectomy when, you know, either tapazole or methimazole is not adequately controlling their systemic thyroid levels seems to be helpful in modifying the disease pathway for their thyroid eye disease. And then I think there are also people like you who, when they have really uncontrolled hyperthyroidism, you know, your systemic sort of sympathetic nervous system is on overdrive, right? And so you're much more likely to have sort of the flight or fight responses going, which is going to give you more dynamic eyelid retraction, which of course is going to make your eyes more dry and more gritty. And you said it exactly the way many people do, that it feels like there's sand in them. So I think that's really interesting. The second thing I wanted to comment on is just really quickly about the radioactive iodine in thyroid eye disease. I think this is and I'm not sure exactly what physicians you were all seeing at the time, but this is like a thing that highlights how important it is that as doctors and medical professionals, we collaborate between the specialties, because it totally depends. Of course, like I would never recommend that an endocrinologist go ahead with radioactive iodine in someone who has severe thyroid eye disease, because there's definitely a risk that it can worsen and you can, you know, have dysthyroid optic neuropathy, problems with the nerve functioning and vision loss. But for someone who has mild disease, there may be things that we can do with other medical treatments targeting the thyroid eye disease, you know, during the radioactive iodine. Obviously, you had the right treatment because, you know, they found that you had thyroid cancer. So I'm happy that happened for you.
Same here.
Not at all like I comment about your case, but I guess just in general, you know, it's I really do personally believe that we provide better medical care when we collaborate between specialties, because we all come at it with different lenses. And I think ultimately what benefits patients the most is when they have a care team around them with a variety of different specialists, right?
Absolutely.
And then there was one thing you said at the end. I apologize if I'm going to paraphrase you incorrectly, but that you don't know if you'll ever be the same you again because you're always going to have thyroid eye disease. That's a really common sentiment, unfortunately. And even though we do have these evolving medications, a lot of these IGF-1 receptors, like Sylvia mentioned, Viridian. I know we're going to talk a little bit about teprotumumab, or Tepezza, the trade name. I think we have not still found the silver bullet, right? Like we're really in the initial phases of understanding the biology of thyroid eye disease. And so even though we're not totally there yet, my hope is that people like you don't feel like they have to live with thyroid eye disease for forever, because the one thing I disagree with both of you about is that there's nothing we can do to treat it in Canada right now. There's tons of things that we can do to make your eyes feel like they are more comfortable, to make them look the way that they used to look. You know, I mean, most of the work that I do is functional, but I do some cosmetic work too. And it's just blending those approaches, right? Because a lot of people with thyroid eye disease, they just want to look in the mirror, they want to interact with their friends and family and not have someone think about what's going on with their eyes. And there are things we can do, for sure. So might not be fully there with all the medicines yet. I think we're definitely making important big steps in the right direction, but there are things we can do right now in the here and now for sure to make it better. So stay optimistic.
Okay, thank you.
Thank you, Dr. Roelofs. And now we'll continue on with Andrea's story.
Thank you so much. Hello, everybody. My name is Andrea Perryman, and I currently live in the United States. I live in Florida, and I'm a thyroid eye disease patient and avid patient advocate. I've been an advocate since about 2021. And I've had a lot of experience with talking about my experiences with thyroid eye disease. So hopefully I can provide a really robust perspective for what it's like to have thyroid eye disease and living in the United States having it too. So my journey with this disease actually began in 2016. I was diagnosed with Graves' disease first. And I went to an endocrinologist and immediately got my blood antibodies and blood levels checked. And I remember the doctor came in and sat down in a chair across from me, and he said, he's like, "You are really sick. You have what's called Graves' disease, a form of hyperthyroidism." And I had a goiter at that time as well too. He pretty much said that I was in a thyroid storm. And so he recommended that we needed to intervene pretty quickly, just because I was losing a lot of weight. I had tremors. I was incredibly irritable. And my heart palpitations were like 125 beats per minute at resting heart rate. So it was pretty intense. And so at that time, there really wasn't a lot that they could do at that time. I feel like a lot of these stories really resonate with me because back then, still there's really not a lot of great treatments for Graves' disease, and I hope that changes. But I understand what it's like when there's not too many options. And so he handed me a piece of paper with like 3 options on it, with like, anti-thyroid medication, radioactive iodine, and thyroidectomy. And then I was immediately put on beta blockers to kind of slow my heart rate down. And then anti-thyroid medications weren't really working for me. And so I was just scared to death to undergo thyroidectomy. And so he recommended, because, of like, I guess, he gave me the best recommendations he could, because of my age, and, that he thinks that the radioactive iodine wouldn't be that harmful. But at the end of the day, when you are in a state of kind of panic and fear, like you don't know like what's going to happen next, and when you're undergoing Graves' disease, you're not in the right state of mind. You're thinking, your thoughts are constantly racing. You literally can't do much. Was kind of confined to the couch because of my elevated heart rate. And so I was thinking like, I got to think fast. I got to do this. And so, I took the doctor's suggestion and did the radioactive iodine, and that did immediately help, my Graves' disease symptoms. But I also didn't understand what the long-term consequences of taking that kind of option was, that now you're going to have to be in a state of hypothyroidism. Obviously you take the medications to stabilize that, but still at the end of the day, I am on medications and I am stable, but at the end of the day, it's not the same as having your thyroid. And so anyways, after that, I noticed almost immediately after I did the radioactive iodine that my eyes started looking really strange. They started bulging out, and I just noticed looking in the mirror, I didn't look like myself. And I was like really kind of freaked out by that. And so I remember at that time I did go to a neuro-ophthalmologist who did CT scans, and they confirmed that I did have thyroid eye disease. But again, at that time, they're just like, well, there's not really much that we can do about it. And so we'll just, you can monitor it. And so I would go to ophthalmologists, I would go to neuro-ophthalmologists, and then I found an oculoplastic surgeon where I lived. And I asked him, is there anything I can do to help, my eyes or whatever, because I had a lot of periorbital edema and my eyes I had proptosis and things like that. And he's just like, well, I would prefer to just wait and see like how your disease kind of plays out. And, and then again, kind of gave me a pat on the back, and I left that day. Like, it kind of makes you feel a little hopeless that there's like nothing that you can do, no type of solutions, right? And I remember going to work and my eyes were incredibly watery, gritty, felt like sand was in my eyes. And also too, I worked in an office with incredibly bright fluorescent lights, and that like was very difficult to work at a computer screen all day with bright lights and light sensitivity and thyroid eye disease. And then not only that, I just didn't want to participate in anything because I just wasn't confident in the way that I looked anymore. And so I really didn't try too hard to stand out at work, even though I was supposed to go to conferences and meet people and things like that. I didn't really enjoy my life. I didn't enjoy doing anything. And then I would just come home and not do anything or go out with friends or anything like that. I missed out on so much of my life because of this disease. And then finally in 2020, somebody came up to me at work one day and was like, Andrea, we're going to do a meeting, and there's this pharmaceutical manufacturer that's going to come to our office and talk about a new drug for thyroid eye disease. Would you like to be part of it? And they didn't know that I had this disease. It was just part of my job back then. And I was like, wait, there's a drug for thyroid eye disease. Like, what do you mean? And so I was like, oh my gosh, yes, I would love to go to that meeting. So I just remember sitting in the boardroom that day, listening to the clinical evidence about the product and, how it's helped people, and they went over everything. And I just remember sitting in the chair that day thinking, wow, like, I think this is going to change my life. I don't know why, and I wanted to look into it, but unfortunately that happened about January of 2020. I'd heard about Tepezza, and then COVID hit. And so at that time, the world was in panic mode, and we all were told we have to pack up our stuff and go home, and we don't know when we're coming back. And so we left the office, and I wanted so badly to look further into Tepezza, but unfortunately, because of all the things going on with COVID, I sort of had to put that on the back burner. And at that time, I'd been living with thyroid eye disease for so many years anyways, that at that point I was kind of in like the more chronic phase where my symptoms weren't getting really any worse. But so that was good news. So I was just like, okay, you know what, I'll look into it, but I don't have time right now. Then I would say around May of 2020, I actually came across a top oculoplastic surgeon in the US who actually helped develop this product, and was, so I was like, oh my gosh, I have to speak to him about this product. And so I did, and I asked, would this product help me? Because the surgeon that I'd spoke to before said that they could maybe do surgery, but because I had a lot of under eye edema and things like that, they said that sometimes it's a higher risk of doing that kind of surgery to remove fluid because it's difficult to remove surgically and things like that. So, I was like, okay, well, then maybe, the drug can help, mitigate that. So I did speak with him, and he said that yes, Tepezza was designed to help bring down the fluid, and then also too with proptosis and everything like that. And at that time also, Tepezza was just released on the market. There weren't a lot of post-marketing studies done on the drug as well either. And so, you know, I wanted to go somebody who understood how to administer the product and how to monitor for the side effects. And also too, if I did need any cosmetic surgery or anything like that done after Tepezza, that, you know, I would, you know, have somebody who was experienced in doing that. So I was like, I figured, you know what, actually the best course I think of action for me to do is to try this IV product first to see if it, you know, I have any improvement with it before undergoing surgery because of the high risks that can be associated with it. So I did try that first. And I had amazing improvement with Tepezza. I mean, it was a game changer for me. It did help me get my life back. And then a lot of people don't realize this, that actually thyroid eye disease doesn't just affect your eyes, it can also affect your entire face. And I mean that, like, it can make your lower face look kind of puffy. Like your cheeks can kind of puff out and make you look like you have like moon face. So I underwent some minor cosmetic surgery too to fix the damage that this disease had brought to my face, because that brings a lot of asymmetries to your face and really makes you not look like yourself. But Tepezza was amazing in helping me again look like myself again, get my confidence back, and then kind of undergoing a little bit of the surgery just to fix those little minor cosmetic asymmetries that thyroid eye disease brought to my face. But I feel amazing. I feel the best I've ever felt in my entire life. That's why I feel like I want to give back to the thyroid eye disease community and help other patients and provide a sense of hope for people that there might not be a cure for this disease, but you can heal from it and you can look like yourself again. And when I tell people that I have this disease, like, a lot of people don't believe me, and that's like the best compliment that I can have. And so yeah, so that's my story, and I hope I was able to provide you guys with some good insight.
Thank you very much, Andrea. That's quite an interesting story. Thank you also for volunteering all the way from Florida. So I appreciate that. Dr. Roelofs.
Yeah, no, I was just going to say I love it because I feel like you ended on such a positive, optimistic note, which is like what I'm always trying to hopefully make my thyroid eye disease patients feel, is like, you know, it can be a journey for sure. It's a journey. There's no like easy shortcut way. Even with Tepezza, it's still a journey. But you can feel and you can look like yourself again. And, you know, it's not going to be a stigmata that has to live on your face for the rest of your life, where everybody knows that you have it and no one wants to say anything. It's more that people don't believe you that you have thyroid eye disease when you tell them. You brought up a really good point, right? Like, there is definitely good scientific evidence that thyroid eye disease patients have changes in a number of the different characteristics of their face, right? There's thickening of the dermis in some of the areas around the eyebrow. Some people think that there's expansion of the buccal fat pad, which changes the shape of your face. So it's, even though we call it thyroid eye disease, it really is a complete pan-facial condition. And I guess that was my comment to Julie about, like, thinking about rehabilitation in thyroid eye disease often does require a blending of the functional and the cosmetic approach and appreciation, because you know, I always explain it's more reconstructive than cosmetic, even though we do call it cosmetic, because we're just trying to take away the changes that a disease imparted on you that change the way you look. We're not trying to fundamentally alter what you were born with or what your, you know, anatomy was meant to be. So I think that's a really nice, nice story to end on. It's optimistic, and I think that's the future of thyroid eye disease. You know, like, every year we understand more about what it does to the body, to the face, to the eyes. And there is like a massive revolution happening with different biologic agents right now that honestly probably will continue for many decades until we know exactly which patients are going to respond best to which biologic inhibitions and which kinds of drugs, and we are really tailored and individualized in the way that we approach patients with thyroid eye disease. So thanks so much for sharing.
Thank you, Dr. Roelofs. I think Anista will now read the audience questions for Dr. Roelofs or the panelists. Please let us know who you want to respond with your question. Please remember, use only the Q&A feature located at the bottom of your screen for your questions. We will not respond to questions from the chat feature or from emails. Anista.
So thank you all for sharing your experiences. That was a great panel. I'll now get started on our Q&A. So the questions aren't addressed to any panelists in particular, so it may be for Dr. Roelofs, but we could have any or all panelists add to the questions if they would like to. So the first question is from Glenda from Toronto, and she has had Graves' eye disease for 40 years. Her condition was stable until 4 years ago. One eye started protruding more and her vision worsened. The pressure also increased. It's stable now, but she was wondering if this is common and what could cause it.
Yeah, thanks so much for your question. It is not common. It's pretty rare to have, I guess I'm making an assumption here that there was truly a reactivation of your thyroid eye disease with worsening of proptosis, but reactivation of thyroid eye disease is pretty rare. Usually I tell my patients the chance of that happening once they've hit the inactive phase and we've finished all of the rehabilitation work that we're doing is about 3%. It's slightly more common in smokers. So, you know, nobody with thyroid eye disease should smoke. Ideally, nobody would smoke, but especially with thyroid eye disease, that's like the most important or like the most impactful modifiable risk factor. And then I think the important or the potentially worrisome thing that you mentioned is about the vision change. So that really needs to be looked at by someone who's at least an ophthalmologist or an oculoplastic surgeon, because, you know, we have a hierarchy of things that we prioritize in all of our personal lives and in all of these different medical conditions that we as doctors manage. And all of these things are important, but vision is super, super important. And sometimes there is a limited time window where we can address problems that are going on that are causing issues with the vision. And so I would say from, you know, that whole story, it's uncommon, but if you have thyroid eye disease and you're noticing vision changes, that is an important sort of urgent visit to your eye specialist because they need to check and see exactly what's going on and if something urgently needs to be done to manage it.
Right, thank you, Dr. Roelofs. So the next question is, my Graves' eye disease is currently stable, but they are always tired, sore, and extremely sensitive to light. My eyes often do not work together and I lose the ability to focus. I often find it hard to focus on faces, particularly if the person is taller than me. Will this always be this way, or is there anything that I can do to help these symptoms?
Yeah, the message I want to leave you all with is that I don't believe anything will always be this way. Like, I think there's always small things that we can do, even if we can't totally get rid of things to make things better. So your symptoms are pretty common for someone who has, you know, we call it inactive or stable thyroid eye disease, the irritation and the fatigue, and some of the light sensitivity. And it all depends on the individual situation, you know, what the best treatment option is for that. I think there's a lot of differences in approach to thyroid eye disease amongst physicians and surgeons. And it all depends on how impactful your symptoms are, whether it's worth going through something for a quote unquote small change. But, you know, I've done many decompressions for people with 1 or 2 millimeters of proptosis who is totally life-changing because it probably gives them, you know, an improvement in some of the congestion in the orbit, an improvement in the exposure of the ocular surface, which improves some of the light sensitivity and the dryness and the grittiness. So I think the key is, you know, being assessed by someone who knows the armamentarium of things that you might be a candidate for, and then trying to personalize or customize the approach, right? Not looking so much at the numbers or always the objective appearance, but looking more at the change from baseline. So I always get my patients to bring in old photographs of themselves before they had thyroid eye disease, because Sure, we measure, you know, I'm sure any of you who have thyroid eye disease, you've had a Hertel measurement, right? Normal for a Caucasian person is less than 21, but I can tell you I have patients who range from 15 to 24, and they're all normal, and that's huge, right? So trying to get you back to who you are, not get you back to the normal range, I think is the important thing to appreciate there. And so yes, it's not always going to be that way. I'm sure there are things that can be done. What needs to be done, you know, whether it's eye socket surgery, eye muscle surgery, eyelid surgery, medical management, like it totally depends on the individual situation. But it's important to consult with somebody who knows the whole spectrum that's available.
Thank you. So the next question is, if Tepezza is approved in Canada, wouldn't it be very expensive? I've heard as much as $100,000. Also, what are the side effects?
Yeah, great question. I have some exciting news that actually I heard from Amgen, the company that markets and sells Tepezza, is that Health Canada did approve it last week, I think. So it is coming to Canada. There's a lot of steps ahead, and like I won't pretend to be an expert on the whole drug approval process, but it will be available. I will say, this is my personal opinion, 100% personal opinion, is that it's not an appropriate medication for everybody. And I think, or at least I'm hopeful, that the implementation in Canada will be a little bit more, maybe regulated is the wrong word, but like I was practicing in the US from 2020 to 2024, and I definitely saw a dramatic shift throughout that 4-year period of how it was being prescribed and what it was being used for. And so I think the benefit of it coming to Canada now, after we do have more real world experience, is that we have a better sense of who it's best for. And there are people who it's absolutely critical for. And as a surgeon, I'm super excited to be able to have it back in my armamentarium to offer people. But it's definitely not for everybody. And so again, it comes down to the personalization, right? And then you ask a great question about pricing. Again, not an expert there. The price will definitely be different than in the United States. How it's going to be administered will be different than in the United States. Like the US is a for-profit system. And so I guess I'm not sure exactly what the prescribing patterns are now, but initially it was like everybody was prescribing Tepezza, whether or not they were maybe adequately monitoring the eye condition itself, right? So I think there will be more, I hope there will be more responsible prescribing of it and regulation, and that it will be used for like a tighter, narrower group of people who it's really beneficial for. And I also think like the drug company, I've had some great experience with them, and I'm optimistic that, you know, for certain people who need the drug urgently, for example, someone who has vision loss from thyroid eye disease, that the company may be able to fund some of those cases directly so that there's not a delay in waiting for government processing. Even in the United States, with some insurance companies that take a long time to process, sometimes you can gain access to the drug on like a compassionate basis for the first few infusions. So I think a lot of the specifics need to be worked out, but I guess my message is that I'm super excited that it is going to be available. It's not for everybody. I think as, you know, as a whole group, and that includes all of you and all of my colleagues and, you know, everybody who's involved, we just need to think about how to best responsibly use the medication. And yeah, customization of thyroid eye disease, like that's the future of medicine, is personalization of everything. And so having one more tool to the armamentarium helps us do a better job at customizing treatments and outcomes for patients.
Thank you, Dr. Roelofs, for explaining so well and in detail. The next question is, I had a hemithyroidectomy 2 years ago for papillary cancer. Since then, my eyelids have swollen and are fluid-filled. I have seen a plastic surgeon, but he felt that surgery would not help and that this is an underlying issue. My endocrinologist has no idea what it could be. what would be my next steps, as this has really changed the way that I look?
Mm-hmm. Yeah, I mean, I don't want to get into like asking you medical questions on a webinar, I guess, but there are lots of reasons to have puffiness or swelling in your eyelids. It'd be atypical if you had papillary thyroid cancer for that to be fully explained by thyroid eye disease, by the pathophysiology and the mechanisms and the antibody interaction that we understand the disease at currently. So I think honestly, following up, even with someone like your family doctor, having them make sure your heart and your kidneys are processing fluid properly. Sometimes when you have generalized body retention, I have certainly seen it present many, many times where the eyelids are the first or even the only sign of it, because the eyelid skin is super thin. It's like a millimeter thin. It's the thinnest in the body. And so when you have a net surplus of free water in your body, it might be the only place that's puffy. You know, especially if it's worse in the morning when you first wake up, because overnight you've been laying down and gravity's been kind of helping it migrate into those really thin tissues. So it may not be thyroid eye disease related. I would definitely have like a full checkup with your doctor to see what else could be going on.
Thank you. So I believe this is our last Q&A question. Oh no, another one came in. But this is a two-part question. So for some quick background, this patient has been managing Graves for 3 years on Tapazole and am now euthyroid and has many of the symptoms of TED, such as socket pain, double vision, as well as central vision in only one eye due to an unrelated issue. The diplopia has seriously impaired vision such that computer-based work is quite difficult. They have been unable to identify a specialist with expertise in TED in their province. And their first question is if anyone in Canada is addressing this disease from the autoimmune perspective.
Mm-hmm. Great question. Yeah, you're not alone in feeling like the double vision is really debilitating. Of all of the different types of patients that I see, those with double vision feel like most impaired from performing their activities of daily living, including going to work, especially if they work on a screen. I think Laz had mentioned maybe, but the Canadian Society of Oculoplastic Surgeons has a website, and we have a directory. So it shows a list of oculoplastic surgeons in every province. Not all oculoplastic surgeons have an interest in TED, but all at least have sort of like a functional capacity to manage and direct your TED-related concerns, or at least assess them. So I would start by having your family doctor refer you to an oculoplastic surgeon. And then whether or not anyone is doing research on the antibody relationship, yeah, there's tons of research going on in TED. Obviously, the Canadian community is much smaller, and so in the American community, which includes many Canadians who participate actively in that society, there is a whole session of our annual meeting that's dedicated to TED. And so we look at a lot of studies that are clinical, but also some basic science type studies where we're looking at antibodies and pathways within the tissue that are leading to some of these debilitating concerns like diplopia. So it's definitely an active area of research. Like I know thyroid eye disease is relatively rare, but for oculoplastic surgeons, it's not. And so within our community, it's an ongoing area of research.
Thank you. So the second part of that question is if there is an interdisciplinary group in Canada like UGOGO that is doing research or practice in this area.
UGOGO is just a European thing. I mean, of course, you have some awareness of it, so you know what the acronym stands for. There is no, to my knowledge anyways, no Canadian group that does similar sort of consensus-based guidelines. It's a little bit difficult. Like at many of the large American academic institutes, including UCLA where I was, we have multidisciplinary clinics, right? Where there's at least an endocrinology fellow that comes to our oculoplastics clinic, and we see patients with thyroid eye disease together on an afternoon. It's difficult for many reasons to do that in the Canadian system. And part of it is just the ratio of doctors to patients and the efficiencies that limit some of that active, like in the moment collaboration. But I can't remember which of the panelists brought up maybe it was Julie. Like it is really important to end up surrounding yourself in that team. Because, so for example, in addition to thyroid, I do a lot of skull base and orbital oncology work, and I have an ENT person and a neurosurgery person that I work with. We don't physically see patients together, but we collaborate, we talk, we text or secure chat about all of these cases. We share scans all the time. So even though, no, to my knowledge, Canada doesn't have a UGOGO group, and maybe there's one place out east that has a multidisciplinary TED clinic. It's just much less common in our system of healthcare delivery. It doesn't mean that you can't still achieve the same level of multi-specialty collaboration and care. It just needs to be done a little bit differently. So.
Thank you. I might mispronounce this medical term, but I had blepharoplasty done 2 years after developing TED. I had bulging eyes and a very difficult time healing. It took months, resulting in one eye permanently protruding. Do you have any comments or suggestions on this, Dr. Roelofs?
That's a tough one. I guess my only comment is that like a surgery is kind of like a dish, right? Everybody's blepharoplasty is not the same as everybody's, like, I don't know, mac and cheese. My daughter loves mac and cheese, right? There's like so many different kinds of mac and cheese you can get from the grocery store. You can make your own, you can make it with cauliflower, you can make all these different mac and cheese. Like a blepharoplasty is not a blepharoplasty. It's not a blepharoplasty. Patient with TED is not the same as the next patient with TED. And, you know, like there's a lot of different layers of what we think about and what we consider before we offer a patient a specific surgery. Because, you know, in ophthalmology, we train doing cataract surgery. One of my cataract teachers when I was a resident instilled in me, you know, the better you are at doing the same exact surgery every time, the better cataract surgeon you will be. And I think that is really true for cataract surgery. I think that's the opposite of true. It's totally false for oculoplastic surgery. Every surgery is different. And every patient is different, and all of their soft tissues, all of their anatomy can be highly different. So I don't know exactly what happened, and I guess I don't know what considerations were not made beforehand, but something I tell my own patients is if they're ever unhappy or they're not confident with how something happened, I'm always happy to set up a second opinion. So getting a second set of eyes on a problem, never a bad idea. If you don't feel like it turned out well, that's probably what I would recommend you do. You know, most surgeons are very open about that and happy to have their patients see somebody for a second opinion. And usually they can help facilitate that process. So I'd go back and chat with your surgeon, make sure that they understand your concerns, have them take a look at it, see what they would recommend.
Thank you. So another question is, can you develop TED even on Synthroid for hypothyroidism for 35 years after a partial thyroidectomy for multinodule goiter? In the last year, I have developed many of the eye symptoms described here, except for bulging eyes.
Yeah, the answer is yes. Like there's very few no's, nevers in medicine. It would be really rare, but it's not completely impossible, you know. How we diagnose thyroid eye disease is based on a constellation of signs and symptoms. To me, and this is what I tell the residents and the fellows that I work with, is that there's not one blood test or one CT scan or one MRI that can say, yes, this person has TED. It's a constellation of all of the different features that we see when we see clinically and when we get some of those other labs or imaging. So it's probably pretty unlikely. It is possible. Seeing somebody who's an expert in the field will help give you that answer.
Thank you. And so we have one last question in the Q&A. What is the reoccurrence rate of TED symptoms following Tepezza treatment?
Yeah, that's a really interesting and important question. I think this is something we've learned more about as we get more of the real world long-term data. And I guess it depends what you mean by symptoms, right? So, you know, reoccurrence of inflammatory symptoms versus worsening of diplopia versus recurrence or regression of proptosis and bulging of the eyes. It's highly variable. again, this is something, you know, like as something like Tepezza becomes available in Canada, these are things that you have to ask your prescribing physician, because in my opinion, it does differ a little bit depending on what type of disease you're presenting with and where in the process you're presenting. If you're super inflamed and you're really early in the disease state, then personally, I think there is a higher chance that you have a recurrence of some of those inflammatory symptoms after completing thyroid eye disease treatment with Tepezza. If you're later in the disease course, then it may be that, you know, this medication is going to help bridge that active and inactive phase, and the chance that you have recurrence of the redness and the scratching and those kinds of inflammatory symptoms afterwards is probably lower. And then, you know, there's some longer term studies that talk about the regression rates in terms of proptosis. And so again, this is something that like every physician has a different approach to utilization and management. For me, I don't use it for isolated proptosis alone, because I think actually surgery can be a really good option with more longevity and less chance of recurrence of the bulging. But it's highly individualized. It depends on the scenario and the situation and what's going on and, you know, what bothers the patient the most.
Thank you, Dr. Roelofs. Are you comfortable answering one more question that just came in?
Sure.
Okay, thank you. So this patient has cataracts, and they're asking if they can have surgery when they have TED after bad time with surgery to correct bulging.
Mm-hmm. Cataract surgery is totally different than, like, I assume the surgery to correct bulging was a decompression. Like, decompression is no joke. It's a pretty big surgery, right? Depending on exactly what we're doing, it's like somewhere between an hour or an hour and a half or even hour 45, depending on how much bone or if we're removing fat or what we're doing. It's a bigger deal. And obviously there's variations in surgical technique and how it's done, and all those things can impact how you recover, what your time was like. I wouldn't draw too many similarities between that and cataract surgery. To be honest, like they are totally different surgeries. So I think having a negative experience with surgery is difficult because it colors your opinion of what the whole medicalization and this process of going for surgery is like, but they're separate. So I can't tell you what to do. And ultimately, I tell every single patient that I offer surgery to that I can't tell them if surgery is the right choice for them, because I don't know all the other factors in their life, right? But when you have a problem that's causing you issues, living your daily life, and you wish it was better, and someone offers you a solution that to you has reasonable risks that are outweighed by the reasonably expected benefits, then surgery is a reasonable option. So you just have to weigh all of those things, but they're totally different surgeries, decompression and cataract surgery. So your experience may be completely different.
Thank you, Dr. Roelofs, for taking the time to answer all our attendees' questions. So that's all for the Q&A.
Thank you very much, Anissa. Great job. I would like to thank our panelists and Dr. Roelofs for commentary on the patient stories. I would also like to thank our webinar team for making this educational event a success. I'd like to mention that if you have spare time and you would like to volunteer to help others with thyroid disease virtually from home, please call us on our helpline at 1-800-267-8822 or email us at info@thyroid.ca. You can also assist us by becoming a member or making a donation by visiting our website at thyroid.ca. As you exit the session, please take a moment to complete our short survey. You'll also have an opportunity to enter your comments. This will help us improve future webinars. Our next webinar will be on May 25th, 2025. Dr. Sana Ghaznavi will present the results of her project entitled Exploring Limitations in the Current Standard of Care for Thyroid Hormone Replacement Therapy in Thyroid Cancer Survivors. Registration is open to all. We hope that you will all join us then. Thank you very much, everyone. Thank you very much, panel. Great job, and Dr. Roelofs, just fantastic. Really appreciated the effort, and the session is really great. So have a good rest of the weekend, Sunday afternoon, everyone. And thanks again. If you ever need to contact us, we're always here.
Thanks, everybody.
Thank you.
Thank
Bye for
you.
now.
Thank you.